Bueno amigos de Perio MX, seguidores todos, estamos muy contentos en este espacio en colaboración con Sepa, en Sepa Granada 2026 y la invitación del día de hoy en este espacio INTEGRA es muy especial con el doctor Ivan Alajbeg. Thank you so much, Ivan.
Thank you. Thank you for the invitation to you and the organizers.
Yeah, as I told you in a minute, we are working with SEPA about communication, networking, social media channels, and we want to spread the knowledge about periodontology. And right now we have a very special moment in periodontology because we have this guide of two gum diseases.
Right.
What is, what can we expect about this guide? This guide is so special because um, everybody talk about periimplantitis, everybody talk about bone regeneration, but everything starts or begins in the gum, no?
Right. I think to start with is maybe to make just a small introduction about my professional background.
Yeah.
And this is oral medicine. So
Okay.
I'm not a periodontist.
Wow.
I'm rather the guy who comes from the other side of the wall, the one who might give you a little bit of vision from the outside.
Yeah.
So I think these guidelines now have taken really serious consideration about the conditions which are maybe a little bit rare, maybe less appreciated by the current periodontal community, less appreciated by the general dentist for sure, because they are kind of maybe rare, maybe not so rare, but they're different, they're strange. So we are talking about 99.9% of the gum diseases that we will be talking about during this conference is caused by some sort of plaque or calculus. However, these ones are not. So these guidelines had a part that dealt with those less common or let's say strange gingival diseases and conditions which I think are very important, and I think it's a big thing that Perio and now Sepa is appreciating these conditions, because I think they are underrepresented first during the education, then during the specialty training, and in the end our patients get frequently misdiagnosed or late diagnosed, mistreated. So hopefully we could make some changes here.
So in general medicine is so important that recognize gum diseases, no, and the net and the connection with our body, no, and what we can expect as a community of not only in dentistry, in general health. So
Right.
it will become a new tool to communicate not only between dentists. I think that we can communicate between oral medicine or general medicine and patients too, no?
No, so Carlos, I think that first of all, we should not be too much relying on general medicine here.
Yeah.
Conditions which are seen in the mouth should be on the domain of diagnosis, or just at least raising some sort of suspicion by the dentist. And then we are the ones who are putting the suspicion. And then some of these conditions, as you rightfully said, are medical conditions, just reflections of what's happening in the body. These are being diagnosed in detail and dealt with different medical specialties. And some of them are life-threatening, but we are very important in order to set a timely diagnosis, not to delay when we are talking about the life-threatening diseases. However, there are some of them which are pretty much mucosal diseases,
Yeah.
which at the end of the day, nobody would be better than diagnosing them and treating but the dentist, only if they want so. And these are not maybe life-threatening, but they can be a little bit more common, and they can also represent very serious, quality of life deterioration for the patient. So I think there are things that I think should be instigating with a little bit more power, instead of throwing all the different and complex and elusive diagnosis to our dental students. I think we should be focusing on those that are not dealt with properly throughout the world.
Oh, and this and this way of part of way, everything starts in the gum about periodontal diseases, focusing periodontitis. We know that if we want to prevent periodontitis, we have to diagnose early the gum diseases. Uh, Induced by plaque or by
Right.
biofilm or not, no?
Yeah.
So what is important because we know that periodontitis has a lot of issues about the treatment and about health
Yeah.
um, after the treatment in periodontitis, but in gum diseases it's not,
Yeah,
no?
it's different.
It's different,
It's
so
different
quite
from the
different.
aspects that you in the periodontology community are combining with general health and how they affect one another bidirectionally.
Well,
This is different. The problem here is that these conditions mostly get misdiagnosed as plaque-related, although they are not.
yeah.
And you know, I think it's about time that we mention some of these conditions. These are mostly referred to as descriptively as desquamative gingivitis, which is a very old, outdated term, which is not a diagnosis, but it's rather a clinical appearance of the things such as autoimmune, mucocutaneous, mucosal diseases such as oral lichen planus, mucous membrane pemphigoid,
Right,
pemphigus
pemphigoid.
vulgaris, etc. So there are more of them. But these tend to be very frequent. You know, I don't know if you knew, but for example, oral lichen planus affects about 1 to 2% of general population.
Yeah.
So it's a lot.
Totally.
And oral lichen planus in about over 30% of the cases will also be affecting the ginger. So it's a lot of people. 10% of all oral lichen planus would be only desquamative gingivitis, nothing else, not those typical features that we teach our students. So it's a bit challenging, but I think it's a lot of place to improve the timely diagnosis and how to help the patients once you have the diagnosis.
And change the mindset for all the clinicians because, well, we are in the most important periodontology meeting for the world. Sepa is so
Right.
important,
Yeah.
but I know that we have to disseminate this kind of tools like these guidelines to restorative dentistry, to orthodontists too, that have to need this knowledge to detect the early detection for all these pathologies, no?
Well, I think that media awareness, what you're doing, what Sepa is doing, what Perio is doing, it eventually reach all those colleagues who should have their awareness increased on that. And I'm here just, you know, the outsider who wishes to help.
Yeah. And, well, talking about the population, right now we have a lot of information in social media channels and a lot of EA. We have a lot of tools to get engagement with a lot of knowledge. So, to the population, it's important to show to the population to teach to our population how important it is to see or diagnose or to check our mucosas, oral mucosas, no?
Yes, when we talk about the population that you refer to, probably it's a dentist population, professional
Dentist
population,
population, first of all.
who should at least have this increase of the suspicious, being suspicious of this could be something else than the plaque-induced gingivitis. But realistically, general dentists, they are mostly focused on teeth. Periodontists are mostly focused on the apparatus
Yeah.
and the implants and the aesthetics. And then, you know, as a student, as a dental student, when you reach to oral medicine, then you say, okay, it's so much medicine and I have so many gaps already around the medicine, so few people. How is it worth it to focus on these conditions as well, since they're so rare? These are not lucrative patients. You will not be earning much. So, you know, it's not easy. It's not easy. I think one of the ways should be to narrow the number of things that we are teaching them, but to expect much deeper knowledge and responsibility. Less is more, I think, here.
What do you expect about these guidelines about the gum diseases?
Well, now the guidelines, the part in which I participated, they're very comprehensive. So I was taking part in the second half of non-plaque-induced gingival diseases, which is about 30 diagnoses plus sub-diagnoses.
Okay.
So if you throw all these things, I think they are very good for guidelines. They should be gathered. But if we are talking, which of these needs to be on the top to get a treatment in a sense that every dentist should be kind of knowledgeable about them, then I think we should narrow this to 1/4 of these. And there is also the part 1. So there's so many things in the guidelines, and apart from that guidelines, I think we should make some sort of decision, be it just at the discretion of one's personal experience, which of these should be put in the textbooks, which of these should be put in the continuing professional development topics.
So, and well, how do you feel here in Sepa? Sepa is a party for periodontology. You've been part for the Sepa family. You're very welcoming. Well, how do you feel here?
I feel very privileged to be involved in this and invited, and it's very impressive. Well done.
Your first Sepa?
My first Sepa. Hopefully not the last one.
I hope so. Well, so thank you so very much, Ivan. It's a nice moment with you. So interesting topics. So we have a lot of homework I have to do about these guidelines, and well, I think that we hope and it's a reality, the oral health with this kind of guidelines, no?
Thank you very much, Carlos.
Thank you so much.
It was a pleasure.
Bueno, pues seguimos aquí en el espacio Integra en Sepa 2026 en colaboración con Perio MX. Gracias.